Good morning, students. I am Dr. Anjali Reji, Assistant Professor from Department of Public Health Dentistry, Vinayaka Mission, Shankaracharya Dental College. The topic for today's lecture is planning and evaluation, under which I will be talking regarding what a health plan is, what are the types of health planning, what are the uses of planning, steps in the planning process, evaluation, its types and steps in evaluation. We frequently use the terms plan or planning in our daily lives. For example, study plan, tour plan, etc. etc. What does it actually mean, or why do we need a planning? Let's take with the same examples. We do a study plan or tour plan expecting a successful and effective outcome. Is it right? So in simple notes, planning is looking ahead. It helps us to know where we are and where we should be. To define, planning is a systematic approach defining the problem, setting the priorities, developing specific goals and objectives, determining the alternative strategies and methods of implementation. And as given by E.C. Benfield, a plan is a decision about a course of action. Similarly, when it comes to the health sector, health planning is the process of defining community health problems, identifying the unmet needs, surveying the resources to meet them, establishing the priority goals that are feasible, and projecting administrative actions to accomplish the purpose of proposed program. Now, let us see the types of health planning. First is problem-solving planning. What is problem-solving planning? It involves with the identification of a problem in a community and then finding the resolution of the problem. For example, imagine if there is a problem of dental fluorosis in a community, we will plan a program like defluoridation or something else to solve that particular problem. This is called as problem-solving planning. Next is program planning. Program planning involves with designing a course of action for circumscribed health problem. For example, if there is a prevalence of dental caries in a particular community, if the prevalence seems high, we can plan for a school-based fluoride rinse program. Next program is coordination of efforts and activities planning. In this type of planning, the aim is to increase the availability, efficiency, productivity and other aspects of programs. Say for example, in a place or a community where birth rate is declining, closing of pediatric wards in hospitals in such areas is an example for this type of program. Next is planning for allocation of resources. What is this type of planning? In planning for allocation of resources, it involves selecting the best alternative to achieve a desired goal when the amount of resources is limited. This is what is called as planning for allocation of resources. Here, for example, replacing fluoride rinse program with a sealant program in areas with high prevalence of pit and fissure caries is an example for the same. Now, after discussing the types of health planning, it is easier to understand why a health planning is important. It helps us to match the limited resources with many problems. N number of problems with limited resources, we can manage it. To eliminate the wasteful expenditure or duplication of expenditure, and to develop the best course of action to accomplish the defined objectives. Here we have the steps in planning process, or otherwise called the planning process or the planning cycle. It starts with the identification of the problem. Then comes the conduction of needs assessment, collecting the data, analyze the data, determining the priorities, development of program goals, objectives and activities, identification of the resources, constraints, development of the implementation strategy, its implementation, and finally monitoring and evaluation of the program, and that is an ongoing process. Now let's see each step in detail. First is identification of the problem. What is identification of the problem? The first step in identification of this problem, we need to conduct a needs assessment. Conducting the need assessment, it can help us to ascertain the cause of the problem. What is the cause of that particular problem in that community? It helps to identify the extent and severity of the problem. It also helps in evaluating the effectiveness of an existing program by obtaining a baseline information and measuring the amount of progress achieved in solving the specific problem. Needs assessment can be costly. Sometimes or many times needs assessment can be a costly one, and hence it can be done in coordination with research activities of other agencies or by investigating the past surveys which are already done. Next is collecting the data. In collecting the data, we should collect information required, which includes the number of individuals in that community, the geographic distribution of the population, the extent and degree of severity of the problem, the attitude of the individuals living in that particular community, the socio-economic status, the ethnic background, diet level, nutritional level, standard of living, fluoride level in that particular community, the health profile of the people, so and so. So these things have to be collected priorly. Once the data is obtained from the needs assessment, the information that we collected must be analyzed before the priorities are determined. For example, knowing the fluoride content of water is important for the planner, so he can decide whether a fluoride supplement program is required or not in that particular community. The analysis and interpretation of obtained data brings out the health problems, health needs and health demands of that particular population. The next step in planning cycle is determination of the priorities. Priority determination is a method of imposing people's values and judgments of what is important onto the raw data. It is used to rank the problems according to the severity and helps to utilize the resources tactically. If the priorities are not set and determined, then the program may not serve the purpose or may not serve the people in need. Hence, when setting the priorities, the planner must ask how serious is the problem and what percent of the population is being affected. So these questions a planner has to keep in mind. The next step in planning cycle is development of program goals and objectives. The program goals, what are program goals? They are broad statements on the overall purpose of program to meet a defined problem. It is the ultimate desired state towards which objectives and resources are directed. On the other hand, program objectives are more specific and described in a measurable way the desired end result of the program activities. As I told, objectives are specific, and hence when an objective is designed, it should meet certain context. As mentioned, as you can see in the screen, you can see certain context. That is, an objective should specify the nature of the situation or condition to be obtained. It should specify the extent, that is the scope and magnitude of the situation or condition it to be attained. An objective should specify the target population, where the program is to be conducted and by when the desired condition is intended to exist. For example, you can see an example on the screen. By the year 2025, more than 90% of the population aged 6 to 17 years in the community X will not have lost any teeth as a result of caries, and at least 40% will be caries free. So in this example, you can see that the stipulated time is mentioned, the condition is specified, the population is specified. This is how an objective should be designed. And regarding program activities, there are basically three components for program activities, that is, what is to be done, who will be doing it, and when it will be done. These things have to be made clear during the development of the program objectives. Once the goals and objectives are set, the next steps include resource identification, identification of constraints, as well as identification of the alternative strategies. Resource identification. Identification of resources implies to the selection of resources needed for the activities like personnel, equipment, money, skills needed for the required for implementation of the program. There should be a balance between what is required and what is available. Certain criteria are there that are commonly used to determine the resources. They are appropriateness, adequacy, effectiveness and efficiency. What is appropriateness? The planner must focus that the resources selected appropriate. That is, the planner should select the most suitable resources to get the job done. Second is adequacy, that is, the extent or degree to which the resources would complete the job has to be focused on. Next is effectiveness, that is, planner should know how capable the resources are at completing the job. And finally, efficiency, that is, the cost and amount of time spent to complete the job within the selected resources. Next is identifying the constraints. What are constraints? They are the roadblocks or obstacles in achieving a certain goal or objective. Identification of the constraints should be done at the early stages of program planning. Why? Because in case if those constraints are there, one planner can modify the design and create a more practical and realistic plan. What are the various constraints that are involved? They may include the limitation of resources, certain policies of the organizations, certain social customs of the community. It can be lack of fund, attitude of the social organization. There can be socio-economic conditions that is preventing the moving forward of a program, etc., etc. So many constraints are there. So being aware of the existing constraints, resources, planner should then consider alternative sources of action that might be effective in attaining the objectives. For example, imagine in a rural setup where adequate transport facilities are not available, we can think of a mobile dental clinic. It might work as an alternative to a fixed dental clinic. So this is an example. So the alternative strategies will help to decide the most suitable plan individually or in combination. So after finishing all these steps, next is development of an implementation strategy. An implementation strategy for each activity is complete when certain questions have been answered. As you can see, like why, what, who, when, how much, so and so. So the planner has to be clear in the questions that what are the activities required, what is the effect of program, who all are responsible for each activity, what will be the sequence of activities going to be done, how will be the resources used, how will be the techniques used, how much will altogether cost. All these points should be clear while developing an implementation strategy. So the process of putting the plan into action is called as implementation. Most health programs can be divided into 4 phases of implementation, which includes the pilot phase, control phase, actualization phase and operational phase. First is the pilot phase, in which the development works on trial and error basis. Then is the control phase, during which the model of a program is run under regulated conditions. It is to judge its effectiveness priorly. Then comes the actualization phase, in which the model of a particular program is subjected to realistic operation. Then comes the operational phase. In this phase, the program becomes an ongoing part of the existing structure. So all these phases of implementation will occur in sequence. Then comes monitoring and evaluation. It is an ongoing process. Monitoring is an ongoing watch over the activities of the health service. Monitoring is not only about watching but also uses the observations as basis for continual modifications of the goals, plans as well as the aims. And for the purpose of monitoring, data has to be collected. Certain data which can be input data, process data or output data. Example for input data include financial report, budgetary report, personal reports, the transport records reports, so and so. Process data includes like how the reports of how the activities were carried out, the report of the program or activities done, and outcome data, that is regarding the outcome with the benefits or services or goods provided by the program. And the program has to be both monitored and evaluated continuously. What is the term evaluation? What do you mean by evaluation? It is defined as the collection and analysis of information to determine program performance. It is concerned with the final outcome and factors associated with it. The continuous monitoring and evaluation is required for all activities during the full course of project. Now let us see what are the uses of evaluation. Why a continuous monitoring and evaluation is required. It helps us to measure the progress of the activity. It measures the effectiveness of each activity. It helps to identify problems in carrying out the activity. It helps to plan revision and modification of the program. It justifies the cost of administering the program, and if necessary, it can even help us to justify the seeking of additional funds. There are different types of evaluation depending on the object that is being evaluated and the purpose of the evaluation. Basically, or the most important types are formative and summative evaluation. What is formative evaluation? It refers to the internal evaluation of the program that is used by the program developers. It is an examination of process of a program as they are actually taking place. It is usually carried out to aid in development of a program at its early phases. On the other hand, summative evaluation judges the merit or worth of a program after it has been in operation. That is, it actually happens at the end to determine whether a fully operational program is meeting the goals actually for it was developed. The other types of evaluation, first is process evaluation. It is the assessment of whether a program is being provided in consistent with the planner's original intentions. Then we have the relevance evaluation. As the name itself indicates, it refers to determining whether the program is needed or whether the program is targeting its efforts at the individuals in need. It refers to whether program results meet predetermined the objectives. The emphasis is on immediate outcomes of the program activities. We have impact evaluation. It refers to the long-term outcomes of the program, and efficiency evaluation, it relates results obtained from specific program to resource expended to maintain the program. Now let's see how an evaluation has to be done, or the general steps in evaluation. The first step is to determine what is to be evaluated. The evaluation can be of three types. The evaluation can be an evaluation of the structure, evaluation of the process, or evaluation of the outcome. Evaluation of the structure means evaluation of whether the facilities or the equipment or manpower or organization meet the standards accepted by experts. That is evaluation of the structure. Evaluation of process is the evaluation of various activities carried out during the program, and evaluation of outcome, that deals with the final result of the program, that is whether persons using services experiences measurable benefits such as improved health quality or any reduced disability, etc. After this, the next step is to establish certain standards and criteria. Why we are setting the standards and criteria? Setting up standards and criteria helps to determine how well the desired objectives have been attained. Then a methodology has to be set, pre-formulated, so as to collect the data required. So once the format is prepared based on the purpose of the evaluation, the information required can be gathered. Once data collection is over, we should do an analysis of the data, and we should give a feedback to the concerned individuals within the shortest time feasible. After which, for a productive evaluation, actions has to be taken. While taking actions, emphasis should be placed on actions designed to support, strengthen, or otherwise modify the services involved. And as told before, evaluation is an ongoing process. It is mainly aimed at the rendering of health activities more efficiently and more effectively. So to conclude, a plan can play a vital role in helping to avoid mistakes and recognize hidden opportunities. Planning helps in forecasting the future. Within a constantly changing world, planning is an essential activity to ensure that healthcare responds and develops appropriately to the new challenges presented. As I told before, it bridges between where we are and where we should be. Thank you for watching my class.